So welcome everybody. As Christina said, I'm the care consultant and education manager. And usually they ask me, what does that mean? Care consultant. So I'm one of the social workers who meets directly with the families, whether it be via phone, in person, virtually, as we are today, to guide them through the process of getting a diagnosis, how to navigate the systems once they receive the diagnosis, or also, what are the resources available in their community. So that's the main focus of what I do, but as Christina mentioned, we do a lot of collaborations with community agencies to continue the care and support of families affected with Alzheimer's disease. And just as something to point out and to give honor to is that June is Alzheimer's and Brain Awareness Month. So right now we have a campaign going on increasing awareness of Alzheimer's disease, about early detection and diagnosis. So if you haven't already, feel free to check out our website and learn about how there are ways that you can engage and increase awareness of Alzheimer's and brain awareness throughout the month of June. So we'll hear further down our presentation a little bit more about those opportunities. And if you have any questions throughout the presentation, feel free to write them down the chat, or in the end, I'll open it up for questions and answers about, the presentation today, or any questions you guys may have about the Alzheimer's Association. As Christina mentioned, we are one of many chapters. We are a national organization, but we have chapters throughout the whole US. I think it's about 80 chapters around there, and I think we have 12 offices here in the state of California. The San Diego Imperial chapter, as you can see, we cover both San Diego and Imperial County, so a lot of our programming is focused in those areas. So the Alzheimer's Association's mission is to accelerate global research, driving the risk of direct reduction and early detection, and maximizing quality care and support. And this is really the foundation of what we set all of our strategic plans on. So as you see throughout the presentation, you're gonna hear about the ways that we are accelerating research, the campaigns that we're doing to reduce the risk of reduction and promote early detection among people affected with this disease. And then also the programmings that we do have to maximize the quality of care of families impacted by Alzheimer's. And of course, our vision, what we hope to accomplish with our foundation of our mission, is to one day live with a world with Alzheimer's or other dementia. So before I start, I'm gonna provide a video of the impact Alzheimer's disease has, just a few highlights about, what are those key facts and figures that are currently impacting our community. Thank you. So as you can see, this disease impacts our community greatly, not only those who are affected by living with the disease, but also the caregivers. And it's also a financial impact for our country. And every year, the Alzheimer's Association has their annual facts and figures. As you can see on the slide, you have our 2020 Alzheimer's disease facts and figures. You can find the full report in our website. But just some other key facts here locally. Alzheimer's disease is the second leading cause of death in California. There's about 60,000 people over the age of 65 living with Alzheimer's, both in San Diego and Imperial County combined. So if you can kind of picture almost a little bit more of Qualcomm Stadium full of individuals living with this disease over the age of 65. And this last bullet point, this came out in our 2019 facts and figure, but I thought it was really important to point out that 82% of seniors say it's important to have their thinking or memory checked, but only 16% say they receive regular cognitive assessments. And what came out of that report is that both the physician and the patient are waiting for each other to ask to get a mini cognitive assessment. So we do know that Medicare covers as part of your annual wellness exam for a mini cognitive impairment test, just like they would do for a blood pressure, but yet they're not being regularly done. So that's something that we're trying to encourage, and it's our continuous conversation to the importance of early detection. So that's something that I wanted to take a point to point out, that individuals want to get cognitive assessed, but yet they're both not having that conversation, both the physician and the patient. So just something that I would like to point out. So as Christina mentioned, we have a long time commitment to Alzheimer's disease research. And one of the things that I wanted to point out, that we have awarded about $18.5 million in Alzheimer's funding research. And we have currently about 540 active projects in over 30 countries. So that's something that we are really proud of. And one of the ways that we fund some of these projects is through the International Research Grant Program. And we have medical and scientists that are part of a committee that they review all of these grants that are proposed. So that's something, again, that if you are a researcher and you have something that you would like to submit, you can also do it through our AOZ.org website. Another thing that we offer is the Alzheimer's Association International Conference, and that's a worldwide conference. Unfortunately, due to COVID, we won't be able to host it this year in person, but because of a blessing in disguise, we are going to offer the conference internationally virtually at no cost. So usually there is a cost attached to attending the conference. Last year, was it in LA last year? Or maybe it was 2 years ago. But this year it will be virtual, and it will be at no cost. So if you're interested in learning about the most recent research happening worldwide, I encourage you to visit, and you can just Google AAIC and you can start registering now. And the dates are July 27th through the 31st. And again, I just want to mention that it is at no cost. And other things that we do to connect and convene other researchers in the area, we have our international journals, we have an international society of researchers. So we convene different types of researchers, like in biotech and pharmaceutical reps who are focusing on prevention treatment. So we provide a space and roundtables to have discussions of these matters. So that's something that we're constantly doing. And we also make an effort to collaborate with the government, such as other stakeholders, scientific, academic stakeholders, such as the National Institute on Aging. So we're definitely increasing and investing into one day living with a world with Alzheimer's. And as you can see also on the slide, we have our save the date for our local Alzheimer's Association research update being hosted August 20th. And so this update is kind of a summary of what happens at AAIC. We also have it every year annually. Due to COVID as well, we are going to have our update online via virtual. So that gives, again, another opportunity for people all over our county to be able to join us. So we don't have the registration link yet, but keep an eye out on it. You can, follow us on Facebook or Instagram, LinkedIn, and you can be up to date. Or I'll have my contact information at the end of the slide. So if you want to get the invite with the link, feel free to reach out to me. But the date will be Thursday, August 20th. So currently, these are just like the highlights. There's so much going on with research, but something that I wanted to point out is the fact that we know that healthy lifestyle habits may delay the onset of Alzheimer's disease. So the Alzheimer's Association, back in 2017, they committed a $20 million intervention clinical trial to assess exactly that, if healthy lifestyle habits can offset the environmental risk of getting diagnosed with Alzheimer's. So that's something that for the very first time that Alzheimer's Association is conducting their own clinical study. It's a 2-year study. And they collaborated with, I'm part of it. We've collaborated with the YMCA to also be able to see if we can actually have concrete data on this. So this study is called the US Pointer Study. Maybe some of you may be familiar with a similar study in Finland, which is called the Finger Study. So that's kind of where they based this study from. And then again, if you would like to learn more about the study, we encourage you to visit our website to find more information about that. And another interesting thing that came out from last year's AAIC was the advancing of emerging blood biomarkers. So being able to detect early on the possibility of a onset of Alzheimer's, so individuals have the opportunity to plan in advance. And again, that's one of the key things of why we encourage early detection and awareness of Alzheimer's disease, because the sooner we plan, the easier it is for families to navigate this disease. And then, of course, studies continue on how Alzheimer's affects women and men differently. One of the things that has been said in the past is women tend to live longer. That's one of the key factors of why women are more likely to have Alzheimer's disease. But there are researchers looking at other biological aspects of being female, or our schooling. They're looking at different factors of why that may be the case. So those are just some of the key research that I wanted to share with you guys today. So as I move forward, the rest of the presentation is really to increase that awareness of, the importance of getting a diagnosis. I believe it's 45% of individuals are aware of their diagnosis if they're living with it. And that's including their caregivers as well. So if we take out the caregivers, it's one individual for every 3 know about their diagnosis. Whereas studies have found that about, I think 95% or 94% of people with the most common type of cancers know about their diagnosis. So that's something that we would like to change. We would like more people to be aware of their diagnosis. And then in that 2018 Facts and Figure report, they shared that those under the age of 84, they were surveyed and asked if they would like to know of their diagnosis. Under the age of 60 would like to know if they have an Alzheimer's diagnosis, and 84% said yes. And those who were surveyed over the age of 60 and asked if they would like to know their diagnosis if they were detected with Alzheimer's disease, 95% said yes. So there's definitely a disconnect that's happening, and that's something that we can do as just individuals, to talk with our family members, to talk to our own primary care physicians. I know some of you work in the neurology department, just the importance of having these conversations with our clients. And in that same study, they surveyed why aren't they having these conversations? Why is this not detected? And for individuals, as you guys may already know, some individuals cover it because of the stigma that's related to having a diagnosis. Many family members don't notice them because they're so used to the routine. And oftentimes it's usually when a family member that comes and visits, or maybe the individual is put in an environment that's not routine. Like many times I've heard of clients that when they go to their vacation on a cruise trip or travel by flying, that's when they start noticing those changes. So oftentimes they're just not aware. There's not enough awareness about the diagnosis. And then when it comes to clinicians and physicians, I think the most common, you can see here on the slide a couple of them, but the most common that came from the report was the fear of causing emotional distress, and also that there's lack of treatment. There aren't many treatment options. So again, the importance of educating physicians, that primary care physicians, that although there's not a cure, there's definitely treatment to impact the symptoms that individuals, sorry, a car is passing by, that there are treatment to address the symptoms that comes from behavioral symptoms. And also, again, the opportunity for families to plan for what's ahead, to be part of organizations such as the Alzheimer's Association or the Alzheimer's Disease Research Center. So I kind of talked about those benefits, but I think for primary care physicians, there is also an opportunity to have a full understanding of the individual. As we know, diabetes is one of a major risk factor for Alzheimer's disease. And if we know that, an individual has diabetes, but also has Alzheimer's, and maybe not more likely to remember to take the insulin, then, you can have a more comprehensive plan. So there's definitely benefits to a timely diagnosis, and also being part of clinical trials. We know that the first survivor is going to come from a clinical trial. So the earlier we can get individuals to get treatment, the more likely we'll be able to have a better outcome for our future. So just wanted to take an overview about that. And as an organization, we're making an effort, as it says here, to close that gap. How can we have more individuals be diagnosed, earlier, or be aware of the resources available in their community? And something that, the Alzheimer's Association advocates, I think it was about 3-4 years ago, we were able to pass the CPT code. So now primary care physicians can get reimbursed to do a cognitive assessment in our care plan through the Medicare annual wellness visit. So that's something that, as an association and as association advocates, work real hard to make that happen. Yet our last year's report showed us that not nearly enough physicians are using this code. So there's definitely still a lack of education that this code is available. So we're offering a lot of physician outreach through locally. So if there is primary care physicians that you're working with or neurologists that you feel would benefit from learning about this CPT code, don't hesitate to reach out to me or Christina, and she can get us connected. Another thing that we did at a state level was our advancement of a public health campaign. We advocated for a $20 million grant to go statewide for the 10 warning signs campaign. Last year it passed for a $5 million grant, so that was a great accomplishment. And what that grant would do would allow different counties to apply to start a pilot program for a public health campaign on the 10 warning signs of Alzheimer's. So that's something that we were able to pass. And lastly, last year with the Out of Council, we partnered to do a national awareness campaign. And I encourage you to check out the videos. And really the focus was on having a conversation about early detection. So it wasn't about, what are the resources there? It was from the very beginning, how do you have a conversation with your family? What were the first signs you saw as a family, and the importance of having a conversation as a family about getting a diagnosis. So if you have time, I encourage you to check out the videos. They're very, very touching, and I think definitely make a difference.
No.
Yeah. And so another part of how we hope to close that gap is through providing resources to professionals. So some of the things that we have are highlighted here. Our website is full of resources, so I encourage you to check it out. If you go to alz.org/HCPS, you'll find information on cognitive assessments for physicians to conduct. There a care planning toolkit, also suggestions on how to manage behavioral and psychological symptoms. So it's full of resources and suggestions for professionals. Another thing that we offer is the Alzheimer's disease pocket card. You can kind of see a picture overview like in the tablet on the slide. And again, it also provides you with the care planning toolkit, cognitive assessments, all in your phone. And then we also are offering from our home office is Project Echo. And I don't want to get this wrong, so I'm going to read. So it's an interactive learning session, so similar to clinical rounds. And you would be partnered up with an expert panel to build the capacity of primary care physicians and also to increase connection with specialty care. So this is something that it's really geared for primary care physicians to increase their knowledge and expertise on on assessing and diagnosing Alzheimer's. So that's something that if you are interested or know, again, maybe some of your partners that may benefit from that, we do offer Project Echo. I know when it first started, it was free of charge. I don't know if it's still going on that way because it was a pilot project at first, but I can definitely try to get more information on that if that's something that you guys are interested in. And then lastly, we have the physician referral pad. As you can see on the slide is a picture of it. And you can order them yourself online and they're free. Or you can connect with us and we'll be happy, when things start opening up, we'll be happy to stop by your office and share that with you as well. And then as Christina mentioned, in order to close the gap again in people not being aware of their diagnosis or increasing awareness of the resources that are available, we collaborate with the Alzheimer's Disease Research Center. One of the things that we've collaborated in the past is our Promotor program, which are community health workers going into different diverse groups and communities to have a conversation on the importance of not only getting a diagnosis, but participating in clinical trials. So we've had presentations and workshops on how to have a conversation and demystifying clinical studies in diverse communities. And an easy collaboration that we've done in the past is My Life Through the Lens. ADRC, focuses completely on executing the program, and we just facilitate the location, right? We host the program. So when things start opening up, if there is a program that maybe you guys need space for, we welcome you to use our space. As Christina mentioned, we collaborate in education programs. One specifically is the Living with Alzheimer's early stage program, and that's something that I work with Yvonne Arias, who's also a social worker from the ADRC. And as you can see here, you have a picture of our support group. We collaborated with Glenner Town Square as well. We felt it was a need in the South Bay for a Spanish support group, and the ability to have all of these partners together just provided a more comprehensive support to those caregivers, caring for someone who has Alzheimer's, but also is primarily Spanish speaking. So it was a great honor to collaborate with both ADRC and Town Square. Due to COVID, we are offering the support group temporarily over the phone. So if you have individuals who might benefit from our support group, again, feel free to refer them to us. And just recently, yesterday, we got on a call with multiple museums here locally, and we're having a conversation of starting virtual museum tours for people living with early stage Alzheimer's. So we're definitely out there in the community trying to increase awareness on the importance of clinical trials, but also the importance of staying connected and engaged with the community. So overall, as you can see, we are advocates for Alzheimer's disease research and to finding a cure, but we're also very committed in providing quality care. So one of the things that most individuals don't know about the Alzheimer's Association is our 24/7 helpline. So our 24/7 helpline, as it says, it's available all day, every day during holidays, after business hours, and individuals can call for really much anything. So it could be a question of, my loved one is feeling agitated, I don't know how to respond to them, I'm at my wit's end, I don't know what to do. There are dementia, master's level dementia specialists to speak with these families to help them through that. Or it could be, I'm noticing symptoms in my loved one, I would like them to be assessed. Do you have any recommendations for a neurologist? They can call the 1-800 number. So really the 1-800 number is available. It is a call center in Chicago, but they transfer any conversation that needs to be processed locally. So I have a direct connection with our staff in Chicago with those 800 number calls. So it's just an extension of who we are, and we're very lucky to be able to offer that service. And just to mention, all our services are free. So as you can see, we, as mentioned before, we have support groups, education programs, our online resources it's very, very robust. And as you see on the slide, there's a community resource finder, and I just wanted to point that out. That's something that you guys can use if you're meeting with a family and they just need a quick referral to a home care agency. You can go to alz.org/CRF and find a home care agency or a residential facility. Or if you are providing a service, so if you are a neurologist, you are a diagnostic center, you can include your information there as well. So it's both ways. It's for providers and service seekers as well. And lastly, just a few more slides, if you were interested in learning more of how you can get involved with Alzheimer's associations, we're definitely always looking for volunteers. We know in order to reach more individuals impacted by this disease, we need to have more people in our team and to be able to reach more individuals. So you can go to volunteer.alz.org, but just as a big overview, you can volunteer as part of the Walk to End Alzheimer's or the Longest Days. Those are our signature events, and those events are the ones who help fund our services beyond, donors and grants. But the Walk to End Alzheimer's and the Longest Day are our primary fundraisers, and you can participate by just joining us and walking with us, or you can actually be part of the committee. So again, if you are interested in being part of that, you can go to volunteer.alz.org. And we're also always looking for advocates, as a lot of the, the funding that we're able to accomplish through the NIH was through our advocates. We're at $2.3 billion in funding from the NIH to Alzheimer's disease research, and that was thankfully done through our advocates. So if you would like to speak to your legislature here locally at a state level or at a national level, we invite you to join us at advocates. And then of course, Trial Match. That's a data system where most clinical trials are put in one bracket, and individuals can go to trialmatch.org and they can set up a profile and connect them to different trials in the area that they may qualify for. And if you are conducting a study and your trial or clinical study isn't embedded there, you can also go to Trial Match and you can request for your trial to be put in the system. So just some upcoming events. As I mentioned, the Longest Day is June 21st, and that's a all-you-can-do fundraiser. So if you like to hike or if you like to sing, you can do a fundraiser. Right now, a lot of things are going virtual. Our annual research update is August 20th, and then we have our Walk to End Alzheimer's. As you can see, we have some tentative dates. But we still don't know how it's gonna look like. We definitely will have a walk. We don't know if it'll all be virtual or half and half. That's still things that we're trying to figure out, but we will walk some way or form. And then if you just wanna continue to stay engaged with us, I invite you guys to go to our website or call our 24/7 helpline anytime, any day. And that's all for me. If there are any questions, I'll be happy to take them.